Thank you very much, Jingo Francis, for that update. I'll be expounding more on that conversation on March 29th. That is going to be Monday. We shall be talking about the customary land system. Did you know that 80% of the land in Uganda is under the customary land system, yet it's not under the national registry? 80% customary land system, yet it's not under the national registry. We shall be expounding more on that on Monday, March 29th. Moving on, we want to talk about why healthcare insurance is going digital in the wake of COVID-19. We've been forced to go into the new normal, which is technological advances. You do not have to trek so many kilometers to get a service. You can get it from your phone, tablet, or computer. Why am I talking about this? Well, in the era of COVID-19 and its effects on the general population in Uganda and the social distancing requirements, companies have had to adapt and some have gone digital. Indeed, to speak to us about why healthcare insurance is also following them, we have Mr. Muhammad Sebali, the Chief Operations Officer at Air Insurance. Very good morning, sir. Thank you for coming.
Good morning, Romeo.
All right, tell us about AAR, what you do, and how has COVID-19 affected your business?
Yeah, well, AAR is a medical insurance company. We've been in existence for over 30 years. We have a regional presence. We're in Uganda, Kenya, and Tanzania. We have a very wide coverage all over Uganda. We go to the deepest areas in Uganda. And then we offer all your medical insurance products that you need. Yeah.
And you've been in the business for over 30 years. You were telling me before we got on the air.
Yeah, we've been in the business for over 30 years.
I mean, if you hear AAR, you might think they just came yesterday, but you've been here for 30 years.
We've been in business.
Tell us about the journey.
Well, the journey, we started as an ambulance service company in Kenya. Then we realized the need for people to get medical services quickly and affordable. So from Kenya, we started to operate with helping people to access hospitals easily. So that is when the idea of health insurance came into play. Then we joined in Uganda in 1984.
So how has COVID-19, as we speak, affected your operations, especially in 2020 when it was too rife?
Yeah.
Yes, and we didn't have any knowledge on how best to fight back the pandemic, but now we have a few ideas on how best to, keep ourselves safe. But during the onset of the pandemic, when things were rife, when everyone was running amok, how were your operations affected by this pandemic?
Yeah, thank you. Like any other business, COVID-19 really affected us. When we went into lockdown, starting in April, business was hard to come by. But then the most important thing for us, how were our people supposed to access services? Because you remember the movements where there was a lot of restriction. So what we really encountered challenges of managing our operations from the point of someone going into a hospital. But then because we had already started on coming up with digital strategies, because the world, we're operating in a digital environment, we had set up a system where people can easily access or easily know where they can go quickly or in their locality. Because you realize that most people, even if someone is sick and they live in Wakiso, they would want to come to Nakasero Hospital, they would want to come. But then there's a hospital set up there. So what we realized is that we could put up something that could easily give you information, give you freedom on what you need to do. And like any other business, we had challenges, with how we take on the operations. But like I said, the strategy was digital. That is the only way that we managed to survive the COVID period, and it gave us more importance to understand that is the only route to go.
And of course, the patients themselves and some of your customers had challenges accessing your medical centers to get the treatment or the medicine, all the services that you offer, which is medical insurance. They couldn't reach you. And then you decided to come up with a mobile application. So what is it for and how does it work?
Well, this mobile application is basically to give freedom to the client, to the member, basically to take control of what matters most to them, which is medical, which is their health. So, of course, many customers were coming, now how can I get services closer to me? Even when I'm in the remotest place, how can I get to know what I need? How can I get to know what I'm entitled to and the balances that I have? So we came up with this app, which is the AAR Insurance mobile app. Basically, in this app, if you are a member, you get to know your benefits. We call them medical benefits, what you're entitled to. You get to know your usage, how much you've used. And this one, when you get to know your usage, it helps you control your benefits. because then you get to understand what I need to do, where I need to go. It shows you the clinics and hospitals within your locality. For example, you just say, I'm in Kampala. Then in Kampala, you see the hospitals and clinics you can access. Wakiso, you can see. Then even you who is not, I don't know whether Romeo you have medical insurance, but if you have someone you want to get medical insurance for, you can get a quote.
Yeah.
Can you imagine? You can just go to that app, then you put in your details, then it gives you the price you're supposed to pay, the premium you're supposed to pay.
So what is the premium, depending? So there is life. Tell me some of the packages that you have.
Yeah, we basically do medical insurance. Of course, we have other products, but it's basically medical insurance. And what is important is we need to know your age and what we call an overall limit. What do you want to get? How much of outpatient do you want to get? How much of inpatient do you want to get? Dental. The moment you plug those figures in, it will give you the premium. And in a turnaround time of one day or 2 days, you become a member. You can access whatever you want.
I see.
So
does the premium keep on changing, or it's a flat one?
No, it's an annual premium.
Okay.
It doesn't change. You know, it doesn't depend on how
90,
much
100?
you've used. It doesn't depend on how much you've used in a year, but it's because we want you to have freedom to manage your.
So how much is it?
It can range from between. It can range from 1 million to 1.5 million.
So in case I fall sick, you just dole out this 1 million to me?
Oh yeah, it's like you have your ATM. You just go and you.
What if the expenses exceed the 1 million or the 2 million? What happens?
Yeah, because
yes.
it's you know, insurance is about risk pooling.
Yes.
Yeah, because you can't fall sick, then the other person doesn't fall sick.
Indeed.
By the end of the day, it's not about you going to the hospital. Even in that mobile app, we have wellness tips that we give you. You know, it's so that you take control of your life. Yeah.
Is there medical insurance for COVID-19? I mean, during the onset of the pandemic, so many insurance companies decided to stay away.
Oh, really?
Medical insurance, we are not offering for COVID-19 patients because people were dying left, right, and center, and would have to dole out a lot of money to be able to actually compensate everyone. At AAR, how are things operating? Are you offering medical insurance for COVID-19 patients?
Yeah.
Or
Yeah.
would be?
Thank you,
patients?
Remy, for that question. You see, in AAR we have campaign. For us, we believe in working with the client to tumble a client.
Indeed. I love that.
During that COVID period, of course, people, you know, when you're in a good situation, you have friends, but then when things go bad, people abandon you. We didn't abandon our clients. We covered our clients for COVID-19, even when they didn't pay a coin
Even when they didn't pay.
even when they didn't pay
Horrible.
a coin for COVID-19.
That's great, Mrs.
So
Simba.
we covered them, and even then we're still covering them. We take care of your testing the moment the doctor prescribes that you need to go for testing. Then we do your medication. If things are worse, we even fly you out. Yeah, because the thing is that it is not, you didn't bring this yourself. We have to we have to manage it as a group.
Were you at some point overwhelmed by the big number of COVID-19 patients coming to maybe claim their insurance, benefits after contracting COVID-19?
Yeah.
Or it's been different for you?
No. Being a new thing that we hadn't seen, because it's a pandemic.
Yes.
By the way, in insurance, we don't cover pandemics or epidemics.
They don't actually.
We don't. Yeah, it's just an additional thing that we had to give to our clients. Yes, there were a number of them. Some of them even, it was an imagination, psychological. You know, you have a cold, or maybe I have COVID, then you have to go for a test. You know, you can't stop someone from going for a test when they feel they need to go for one. So we had many claims really come through, but because, like I told you, that AAR is a big company, we had to shoulder that, even when people didn't pay.
Have you had situations whereby people have to fake the COVID-19 certificate so that they could get your money? They should come to AAR and claim and get their money. I've had this situation. Someone crashes their own car because they want to get that insurance money. Have you had fraudsters, attack your services just to make a living or make a living off of that?
Yeah, there's fraud in insurance. Generally, there's fraud in insurance, but for the issue of COVID, it wasn't as such, because there has to be a prescription from the doctor, that you have COVID-19.
Which you've already faked. You've paid the doctor already.
Yeah,
if I'm getting 2 million from AAR, I pay 200,000 to the doctor, I get a certificate, I have COVID-19, boom.
Yeah, like I told you, we have clinics and hospitals that we deal with.
Yes.
Yeah, that's the network. So you take those tests from those facilities
That you trust.
Yeah, but if you connive and then you end up getting the test,
Indeed.
you know, for us we pay the hospital. We don't pay you. We pay the hospital. Only when probably there's you could not access a facility, then we do medical refunds. By the way, even in that app, if you go visit a facility, but then it is not one of our facilities, and then you pay your money, you get the treatment, because what matters for us is that you go to the treatment. When you get the treatment, you just take a pic of your receipt and the prescription or the medical report, then you send it to us, so you claim for your money using that app. When
Of course.
Yeah, when you claim for your money, we pay you in 3 days. We can even pay you with mobile money. So it's it is an initiative that is meant to simplify the way people look at medical insurance.
Mr. Sebale, let's talk about cyber attacks. During the onset of the COVID-19 pandemic, there were so many cyber attacks on digital platforms. Many digital platforms were susceptible to these cyber attacks. What are you doing with this mobile application to actually offer safeguards to your clients? We look at situations whereby there's a one Romeo Busiku ailing with a certain disease, there's a one Robert Chagulanyi ailing with a certain disease, and then all of a sudden our information is on Google.
Yeah, okay.
You get what I'm saying?
Yeah.
What kind of safeguards are there while people use this mobile application so that their information is not out there, you know, among members of the public?
Yeah. Given that we are dealing with a very complex issue of life, which is medical, security is very important. Our systems are highly secure, because we do audits, we do system audits on a constant basis, and we sign confidentiality forms and agreements, even with our providers, the clinics and hospitals.
That's great.
So the thing is that when you are using this app, we have what you call a UG number. A UG number is a unique number to you. When you become a member, we assign you a number. Now, anyone without that UG number cannot log into that app. So the thing is that if I have a UG number and you have a UG number, I cannot log into your I cannot get access to your details. So, and then even a new member, you can only stop at requesting for a quote. You cannot go into to look at my utilization. Yeah. So the cyber attacks have been there, but fortunately, you know, everything to do with systems. We started investing in systems in 2010, real time and strong systems. So in that, we have not experienced any cyber attacks.
Away from the challenges that could plague any digital system, let's talk about the good side, the pros of actually using digital insurance. Why is it so important, Sebale?
It gives you freedom. It gives you freedom to manage your benefits. It gives you freedom to understand where you need to go. It gives you comfort. Yeah. And it
eliminates the threat of you contracting COVID-19 as you board a taxi to go to a health center.
Exactly.
Or a border.
Exactly. I don't know whether, Romeo, you've been to hospitals where you find a very long queue.
I haven't, and I don't think I'm visiting any hospital unless I fall sick, because there is that risk of actually getting infected if you're healthy already.
Exactly. You know, people have not been going to hospitals because they fear to be infected.
That fear has always been there, especially in 2020.
Yeah. So for us in AR, we realize that the digital way is the only way to save people from even getting more diseases. So we're also venturing into what we call telemedicine. Telemedicine, where you don't have to see a doctor. You see a doctor virtually. You know, the doctor examines you, and when they find that there is need to take your blood test, or they'll go and take your blood test. You don't, and then they'll deliver the drugs to you.
Mohammed Sebale, the Chief Operations Officer at AAR Insurance. We're having this conversation on why it is so important for medical insurance to go digital in the wake of COVID-19. Let's have a traffic update with my brother, Stephen Mbide. He's back and he's doing great things. A very good morning, Stephen Mbide. What's the latest?
Yes, good morning to you, Romeo Busiku. It's good to be back. Thank you so much, Romeo Busiku. Right now, I'm here at the traffic lights of Lugogo at the junction linking you towards Ginger Road side as well as Lugogo bypass. For you who is coming from that side of Bukoto, trying to use this Lugogo bypass, just know that this particular place, which floods a lot whenever it rains, is just having less congestion if you're coming from around that side of traffic lights near Ginger Road Police Station, or if you're coming from the other side of Naguru, joining the Lugogo bypass. It's less inconveniencing, just 2-3 minutes of waiting time as you connect towards these traffic lights of Lugogo. And if you know you're coming from that side of Nakawa Trading Center, joining this particular traffic lights station here, you also be losing those means like 5 to 10. And if you're coming from Banda Chambogo, just know that before you connect towards the Spear Junction there, you're going to be losing some 30 minutes between Banda Chambogo and this particular point. But after this, heading towards the city direction, less inconveniencing because you only be losing another 3 to 5 minutes of your waiting time at the Spear, the Wampeo Avenue roundabout and the Chitigumu House traffic junction there. If you're coming from the city direction, coming from Kampala and Wampeo Avenue, coming towards Lugogo, is also just less than 3 minutes of your waiting time as you connect towards this traffic lights. After this, you also be driving without any delays there. And connecting towards Lugogo side, from Lugogo to Chira Road or Naguru is also so clear. But here you can see that border riders there are stopped at the middle of the road, which is so dangerous for you as a rider and as well as a passenger. It's too bad because here it's supposed to be left for the vehicles coming from either the Nakawa side, and you can see that there's a mix of borders coming from Nakawa side and those coming from the city. You can easily get an accident there if you're not so careful with by cautioning this border rider. It can lead you to a nasty accident. This is what's happening on the road for now. Taking you back to studio for a short commercial break, and Romeo Busiku will be right back there with so much information, with other guests there giving you what you need this Thursday morning. Keep it here on Morning at NTV. Stephen Bido Fefeswe will be back later on with real issues, real people on the ground.
My brother Stephen Mbide, welcome back, and please continue doing great things. Well, he looks great. You're still watching Morning at NTV. Mr. Sebale is still here. We are talking about digital insurance. Mr. Sebale, do you think people will adapt to the new normal, which are the technological advances? You know, there is a tradition in Uganda, unless something persists, people might not adapt. If people don't think COVID-19 is going to be here till 2023, they might not adapt to the technological advances that we need to actually stay in the new normal. What do you think?
Yeah, I think there is no option. Honestly, there is no option but to adopt to the changes in the environment, which is digitization. Because even when you look at COVID is here to stay. I believe COVID is here to stay, and people have started actually to realize that they need to distance themselves from what they can avoid. So you find that someone would not really have to go to a hospital if they can get the drugs delivered to them, if they can see a doctor virtually.
And that was my next question. What else you're doing to be able to reach out to people you are able to be reached out to physically? You know, what are you doing now to ensure that they reach you, besides the digital insurance system?
Of course, the other part of our business is that other people still visit the hospitals. Yeah, for us, our job is to make the hospital facilities and clinics available. But then we also bring something new, telemedicine. Telemedicine is where you don't have to see a doctor, you don't have to go in the queue. Yeah, you only have to see a doctor virtually, then they examine you based on the symptoms that you present. Then they ascertain whether you need to get a lab test. Then the lab test, they will come and pick your blood sample from anywhere you are at your convenience. Then they come back with the results, then they decide on whether they need to give you drugs, a prescription.
Mohammed Sebale, the Chief Operations Officer at AAR Insurance, many thanks for having made the time to speak to Morning at NTV.
Thank you very
People
much.
are wondering, how best can I access medicine even when I'm at home? Can I get medical insurance without leaving the comfort of my home? And you've made it very, very clear that they can do that with the mobile application. Thank you very much.
Thank you very much.
And indeed, to you who is watching Morning at NTV, you've been loyal since 6:30. Thank you.